Welcome back. In this video we'll be talking about the following terms, which include schizophrenia, schizophreniform, schizoaffective, schizoid personality disorder, and schizotypal personality disorder. These terms have always been confusing, so I decided to make a little video about them to help you differentiate between them. First, we must understand what do we mean by psychosis. So meet our friend Mr. Ski right here, and let's diagnose him with psychosis. We can call Mr. Ski a psychotic patient if he had disorganized thinking, hallucination, and delusions. Keep in mind that the hallucination could be visual, and we see this mostly in patients taking drugs overdose, or auditory, which is the most common type for schizophrenia, or gustatory, which is change in taste, and we see this mainly in patients with epilepsy, or olfactory, which is smelling, and we see this in aura of patients with migraine. Alright, so now that we know how to diagnose Mr. Ski with psychosis, let's diagnose him with schizophrenia. To call Mr. Ski a schizophrenic patient, he has to have the following symptoms for at least 6 months, which include psychosis, plus either negative symptoms or positive symptoms, or both. So in other words, schizophrenia is psychosis plus negative or positive symptoms for more than 6 months. Negative symptom is a decrease in normal function that we all have, which includes alogia, which is a one-word response. The normal function in this case is that if you ask someone a question, he would usually reply with sentences, but schizophrenic patient like Mr. Ski would only reply with one word. Negative symptoms also include anhedonia, which is decrease in feeling of pleasure, avolition, which is decrease in motivation, and flatness, which is decrease in emotional response. Positive symptoms, on the other hand, is adding something that wasn't there before, like catatonia, which is strong stiffness of the body. Now let's see how to differentiate between the confusing terms that we spoke about before. When we say brief psychotic disorder, it means that the patient will have psychosis symptoms that we discussed before for less than 1 month. And schizophreniform disorder means that the patient will have the symptoms from 1 to 6 months. And schizophrenia is having the psychotic symptoms for more than 6 months, plus negative or positive symptoms. The way I remember this is that brief is brief, so it's less than 1 month, and schizophreniform is from 1 to 6 months. So form looks like from, and schizophrenia is more than 6 months. Schizoaffective is having an additional mood disorder on top of psychosis. So affective starts with an A and additional starts with an A as well. Schizoid personality disorder and schizotypal personality disorder are both normal people with no psychosis. A schizoid person would be socially withdrawn and would rather have no friends and stay alone. And schizotypal person would have odd beliefs and odd rituals. So again, both personality disorders are not psychotic patients, they're just normal people with abnormal traits. Alright guys, that's everything I've got. Hopefully I made this easier for you. Thank you very much for watching, and tell me down in the comment section below whether or not I should continue using these emotes and these small animations, or should I just go back to plain text, whichever suits you guys. And till then, see you guys later.